Please give a warm Georgia Tech welcome to our guest, Donna Hyland.
Thank you. Thank you. So I want to know before we start, how many of you have to be here and how many of you chose to be here? Be honest. No, I'm kidding. I can remember when I was your age, which I still think I should be your age, come into these kind of things going, who is this person? So I really do appreciate you all being here, and it's a thrill for me to be here at Georgia Tech. I'm actually on the Georgia Tech Advisory Board, and I have learned so much and have such high regard for this organization and all the great work that you're doing. And one of our great board members here, Don Chapman, has a lot of influence on that, as well as others, which your very own Waffle House provided by. So I'm thrilled to be here to talk about a number of things. One is children's, which I absolutely love and love to talk about. And the other is to maybe share some of the leadership lessons that I've learned, which I hope might be helpful to you as you move into whatever areas of the world you're going to be moving into when you graduate from Georgia Tech. But before I started with any discussion, what I thought I'd do is start with a video that really shows you why I do what I do. Well, I wanted to start with that because that's what describes children's health care and what we do. And the other big point I would make there is the reason I do what I do is because I have such a passion to help these kids and have been lucky enough to be in a job that I'm able to do that. So probably my first bit of advice to you would be do something you like, do something you love, find something you have a passion for, and whether it's kids, by the way, I was an accountant. You're probably saying, how in the world did you get to where you are? Your path may not be as directed as you think it is, but it certainly has been very, very rewarding for me. The second reason I wanted to show you the story about Julia is because it's part of the relationship between Children's and Georgia Tech. If I had been diagnosed with ALL when I was 8 years old, it would have been a certain death. But today, because of research and because of collaboration, the cure rate for ALL is 80%. And that's happened in about 30 years. The cure rate at the Aflac Cancer Center here in Atlanta is 87%. So think about that. That's a lot of progress in a number of years. And the reason that we've been able to do that is because of collaboration. There are 200 childhood cancer centers in America that put all of their data, they put more kids go on clinical trials than adults. Those kids go on clinical trials. All that information and data goes into a central database, the Children's Oncology Group, and it's studied. And so that we're constantly translating the most effective cures, and as a result of that, you see what's happened. 25% to 80% to 87%. And so collaboration is really the name of the game in healthcare and in many, many of the businesses today. So I think that's a skill that I can tell you, again, coming through accounting, I don't know, are they teaching collaboration in engineering classes these days? Hopefully you are, because it's so important. The ability to leverage, there's not enough money, there aren't enough resources out there, and that's particularly true in healthcare. So it's more and more important for us to be really good at collaborating. At Children's Healthcare, we are so thankful for Georgia Tech because we've been able to combine the resources that we have, which are mostly physicians and clinicians, with all the fabulous talent at Georgia Tech. And it's pretty amazing what's happened when we've brought those together. And I'll show you some examples of that in just a little bit. So let me tell you a little bit about children's health care. First thing I'll tell you, kids are not just small adults. Does anybody know what this picture is? It's a heart. Most of the heart surgery that we do are on babies because they're congenital. It's congenital issues. And actually, our pediatric heart surgeons actually follow people all the way through adulthood. They didn't used to live all the way into their 50s and 60s and 70s. So we have pediatric heart surgeons that are still working on 60 and 70-year-olds. But you can see that heart is about the size of a plum. And so you have to be highly specialized to do heart surgery on a heart that size. We also have to have specialized pediatric anesthesiologists who know how to anesthetize a child of that size while they're on bypass getting that kind of heart surgery. You have to have nurses that specialize in that. You have to have equipment that specializes in that. So children's hospitals are really different places. Kids are not just small adults. They're different in every way, and fortunately in Atlanta we have one of the top children's hospitals in the country now. And that's a result of, in 1998, there were 2 competing children's hospitals. There were actually 3, but 2 of them were extreme competitors. And for some of the folks here on the front row, Bill Todd can certainly remember this. We were putting billboards across from each other, building duplicate facilities, a lot of waste. The philanthropic community, which donated to both, basically stepped forward and said, enough is enough. You're both asking us for money. You're not using it wisely. You're using it to compete with each other, and we're just not going to continue to give. So that resulted in the 2 boards coming together. Representatives from Egleston and Scottish Rite came together, and remember, they'd been competitors. One was built in 1915, the other in 1928, and they had been competitors for all these years. They sat down and they agreed on 3 things. They agreed that sick and injured children belong in a children's hospital because they get better outcomes, that as trustees, they didn't own these institutions, they were fiduciaries of them. These are not-for-profits, they're owned by the community, and that it was their obligation as fiduciaries to preserve this precious resource for generations to come. They agreed on those 3 things. We did limited due diligence, enough to make sure that if we merged the 2, there wouldn't be something that would be so untoward that we wouldn't be able to function, and that the 2 were merged. So that was in 1998. Roll forward to 2011, and what you see is we're one of the top. We've been able to pull those 2 things together, 2 hospitals together, add a couple to it, and we're now one of the leading children's systems in the United States. Last year we saw 315,000 kids. We've been recognized by Fortune as one of the best places to work for 6 years in a row. We're one of 3 companies in Georgia. Aflac is one, and Austin Bird is the other. We're recognized by U.S. News & World Report as one of the leading children's hospitals. And we are providing basically the pediatric care for the state of Georgia. We now see about 9 out of 10 kids in Metro Atlanta. At the time of the merger, by the way, combined, it was less than 5. So we've gone from less than 5 combined to 9 out of 10, and for the whole state, we're now about half of all the kids in the state are dependent on us because we're the specialty resource, and we've gotten so good at it that that's why people are coming to us. The other major difference about a children's hospital, you see this $125 million in community benefit. We see every child in Georgia regardless of their ability to pay. So that's another really big difference about a children's hospital. And one of the things that we treasure is that if you're in our hospitals, the doctors and the nurses don't know who has insurance, who doesn't have insurance, who has Medicaid, who doesn't. Because it's a fundamental belief that we have that all of those kids should have the same chance at the best health care that we can provide them so that they can grow up and be healthy adults. So a little bit about collaboration. Our board, once we put these organizations together, which by the way, in 2006, we added to Egleston and Scottish Rite Hugh Spalding, which is the children's hospital that is part of the Grady system. It's downtown, not too far from here. And then in 2008, we added the Marcus Autism Center. So we now we're very unique in the country in that we have the pediatric resources under one umbrella. This is a very large urban area, as you know, to have all of those resources under one. It's enabled us to use some of the kinds of skills that you all offer and really rationalize and optimize the flow, the efficiency of care, and the quality of care, because we've been able to really have a distribution system across that. But when it comes to collaboration, I think because of our culture and who we are, and we've seen so much that we can do by working together, we said when we were going to get into research, some of our other colleagues around the country, Children's Hospital of Philadelphia, Children's Hospital of Boston, all of their research is actually owned by them and they do it. What we said when we started to look at it is, wow, if we're going to make investments, why not go tap into what's at Georgia Tech and what's at Emory and what's at Morehouse? Because if we started to build this, gosh, it'd probably take us about 30 years, 40 years. What if we took the money that we were going to invest and we leveraged it by going to all these fantastic places that we have in Atlanta that are already in existence? And that's what we've done. And a couple of my favorite examples are we have one of our pediatric neurosurgeons, one of our pediatric oncologists in the Aflac Cancer Center, and your very own Ravi Belakamba, which you all know. The three of them together just won the Eureka Award, which is the first time the National Cancer Institute has ever granted that award in the state of Georgia. And their concept was that Varun, who's a pediatric neurosurgeon, was a biomedical engineer before he went to medical school. So when he got into the brain surgery, he thought a lot about a lot of those engineering, that engineering skill. And what they did is they tackled medulloblastoma, which is the leading brain tumor and cause of death in children. Kids who get brain tumors, get brain cancer, the medulloblastoma has a very high mortality rate because they're inoperable. They're usually at the base of the brain, and they're impossible to get to be able to remove them or really effectively radiate them. Their whole concept was, well, if you can't go in and get them, what if you used some polymers and you pulled them out through a path of least resistance, and you could pull them to the outside of the brain, and then you could either radiate them, remove them, or pull them out to a sink, and you'd be able to treat them. And that's what they've been able to do in mice models. So it took Ravi's engineering skills and knowledge of nanomedicine and all the things that he knows, Varun's knowledge of the brain, and Toby McDonald, who's our Aflac physician, is a cellular, he specializes in cell transfer and cancer cell transfer. So look at what happened when the three of those came together. If they really can perfect this, it will have a profound impact, certainly on pediatric brain tumors, but think about all the other applications for that, where you have tumors inside major organs that are inoperable. So it's so exciting to us to see what's happening. Another great example of our collaboration is Dr. Ami Klin. Autism happens to impact about 25,000 kids in Georgia. And Bernie Marcus very generously many years ago started the Marcus Autism Center. He came to us a few years ago and asked us, because of our success, would we take that on and manage it? We did, but we didn't have the kind of leader we needed. So we went to the world and said, where is the world's leader in autism? And it was a gentleman named Ami Klin, who was at Yale. He'd been at Yale for 20 years. He was immovable, we thought. But what happened is we had Georgia Tech, Emory, Children's, Bernie Marcus, Yerkes, many people came together and basically brought Ami to Atlanta, and he was so impressed with what he saw. He really couldn't believe what he saw, because we were able to show him all of what is at all of these fine organizations, and that we would all be interested in bringing him here. And as a result of that, we were able to recruit Ami. Ami brought with him about 5 or 6 researchers from Yale. And the reason Ami is so famous about what he does is Ami has developed a technology to diagnose autism as early as 6 months, and it's through eye tracking. So his whole premise has been the development of, do y'all remember when you would go to the pediatrician when you were growing up and you'd have growth charts? He's developed growth charts that are eye tracking. And so starting at 6 months, basically a baby can just look into, it's a machine that he's developed. It's not invasive, it's just looking in and it's filming the eye tracking, and they do that repeatedly. And what he's been able to see is kids with autism, they go off the growth chart in terms of their eye tracking. The beauty of this is if you can identify and start to treat kids as early as 6 months, you can attenuate the long-term impacts of autism. And right now in Georgia, the average child is about 6 years old when they're diagnosed. And we all know how pliable the brain is between 6 months and 5 years. So there's a lot of impact that we can have with that. So Ami is now here with his research team. He's working with Gregory About and lots of people at Georgia Tech, and he's going to be fabricating these machines, and we're going to be putting them in pediatricians' offices all over metro Atlanta and really doing a research study in addition to providing the kind of care and treatment to kids and having, again, a profound impact on kids with autism. Isn't that exciting? To think that that's happening. And if many of you may be impacted by a family member or you know someone with autism, almost everywhere I go, almost everyone in the room has someone that they know who has a child with autism. So we're just so excited about that. And Atlanta is such a rich place with talent, and we're taking every advantage that we can of leveraging that, and that's why Children's has become what it is, because we have such great friends as you and Emory and Morehouse, and just a mindset that we're very willing to work together. The other thing I thought I'd talk a little bit about is the power of people. People, we believe, are our strategic weapon. Because that's what really differentiates any organization is your people. You have to have great leadership, and you have to have the right people in place. And now I don't know, again, if you're teaching differently in terms of when I was in school, going through accounting, we didn't spend a lot of time talking about the importance of people. It was pretty much about the numbers and the numbers going into a box and everything balancing. But I think this is such a critical element of running any organization, is the ability to rally people and to get people to have the kind of culture that will enable whatever your strategy is. Have you all ever heard the term culture eats strategy for lunch? It really is true. And we have some examples even here in Atlanta of one of my favorite companies, Home Depot. If you look at what happened to Home Depot way back when you had Bernie and Arthur, and then, Home Depot was kind of the wild, wild west. It had a culture of, decentralized decision making. Customer was number one. Not a lot of rules, not a lot of process. And then they brought in Bob Nardelli from GE, which is where they invented Six Sigma. So Six Sigma and the Wild West, do y'all remember what happened? For about 7 years, Lowe's stock price doubled. Home Depot's didn't. Home Depot stayed flat, and Lowe's kind of, really took off. Frank Blake was promoted, and Frank Blake is really now working on kind of putting the magic back in to Home Depot. But I think that's one of our best local examples of what happens when your strategy, I'm sure it was a great strategy, and Bob Nardelli was a very talented leader, but it was just when the culture and the strategy don't really mesh, you can see that you can't achieve what you're trying to do. So Children's, what we did a number of years ago is we said our people are going to be our number one strategy, and we've really invested in that. And we had to spend a lot of time understanding our people. We did a lot of focus groups, we did a lot of listening, we still do a lot of listening, and understanding what do our employees need, what do they want. And one of the things that we learned when we did all of this listening is, what does it take to work in a children's hospital? Anybody have any guesses? What characteristics do you think it takes to work and be successful working in a children's hospital? Patience. Passion. The resounding thing that we identified across all disciplines was you had to be strong. You had to be like strong as steel to work in a children's hospital. So we adopted the kind of our mantra was strong enough to care enough, because you do have to be passionate, but you had to be really strong. And you typically don't think of treating sick kids with strength, but after you think about it, it really does come together. So we listen to our employees around, strong enough to care enough, people really relate to that. Then we said, well, what do you want from us? Well, everybody wants fair pay and benefits. That's kind of, it has to be a given anymore. But what they said to us is, we want to keep learning. We want you to keep providing us with the opportunities to learn and develop. How do you help us grow as individuals? 85% of our workforce are females, mostly working mothers. They said, you got to help us with work-life balance because it's so important. I have kids at home, I may have sick kids, help me with that. So we had to put a lot of programs in place around work-life balance. And the last thing they said is, we need you to recognize me and respect me and thank me for what I do. So we spend a lot of time doing that. We say that every job is important, no matter what the job is, and that every individual should be respected, and we really live that. As a result of that, I will tell you that once we made people our strategy, our quality has improved significantly, our customer service has soared, and our financial results have soared. So I think that people are one of the most important things that you should focus on, whatever leadership role you're in. The other thing as a leader that I would say is critically important is your main job as a leader is to set direction for the organization. Because everybody's out there working, you've got to set the direction. Then you have to align all those people. You have to align them in terms of what you need each of them to do and how all that comes together to achieve your goals and objectives. And then you have to inspire them and motivate them. And that's kind of the magic that comes in. Because most people, you don't like to be, you need to be told what you need to do, but then you want to be given your own creative, you want to be part of it. You don't want to just walk in and, go to the grind and crunch things out. You want to bring your own inspiration to it and your own motivation. And I think that's one of the most important things, because that's where you really get all the great surprises that, you wanted to go here, people will take you there if you just let them. So that has been an important part of our journey. And the last thing I wanted to talk to you about is something that is very, very important to us at Children's, and that is childhood obesity. We have the second highest rate of childhood obesity in the United States in Georgia. And as we've looked at it, about 900,000 kids are impacted in this state by overweight and being obese. So we knew that we needed to tackle this, but before we did it, we wanted to start with our own employees. Because healthcare workers overall are some of the least healthy that you can find, which I know is counterintuitive, but it's true. So we started with our own employees, and we built a program called Strong for Life. And it's really all about physical activity, it's about nutrition, it's about getting support, and it's about having fun. And so I wanted to share with you some of the successes we've had with our own employees, and then what that has led us to in terms of a childhood obesity campaign, which we've just launched in Atlanta. So I'll end with saying, we have a responsibility. We could have sat back and really done nothing with this. If you think about it, it's good for business for people to be sick. If you really got right down to it. So why would you spend $25 million to put yourself out of business? And it's because if you're a not-for-profit, if you're a community organization, you're there to serve the people and do the right thing. And I'm very thankful that we have a board of trustees that was willing to invest the kind of money, because if we don't reverse this trend, I cannot even imagine what our state will be like 10 years from now. Did you know this is the first generation of kids who are expected to live shorter lives than their parents because of this issue? So when we say, how can we not? How can we not? And when the way we came up with these ads is we interviewed kids and we interviewed parents, and these kids said, we need a voice. We're getting bullied. We're getting picked on. We never get picked. We're isolated. Please be our voice. Please help us bring this issue forward and give us help. And what we heard from the parents is, there's not a problem. which is why we had to start with this pretty stark awareness campaign, because you don't get help unless you think there's a problem, and we have a job to do to try to help Georgia understand that there is a problem. So thank you to Georgia Tech. Thanks to all of you. I hope there are many, many future leaders out there, and that some of you 25 years from now will be standing up here taking on some issue like this to make a difference. And I think we have a few minutes for questions. Anyone have any questions? Y'all just want to get out of here, don't you?
One myself. You talked about collaboration earlier in your discussion. You talked about collaborating with colleges and the community. What about collaboration across other children's healthcare systems in other states in terms of sharing best practices and protocols? Do you do much of that as well?
Yeah, absolutely. That's a great point. The children's hospitals really work very well together. There are 43 freestanding children's hospitals that share all of our information, and we're constantly looking for best practice. So we've set quality measures, and then we compare ourselves against that. Again, all that information is in a big database. We need some of your kind of brains to help us mine it and get there's a lot of information there that we're not accessing, but the big children's hospitals in this country absolutely work together in a very cohesive way to try to raise the level of quality nationwide. And that's pretty different than you'll see in adult health care.
Hi, my name is David Vigil. I'm a fourth-year management student. I was curious, what role do you think that private primary care providers will be playing in medical care over the next 20 years?
Primary care as in general pediatricians?
Like general pediatricians.
Yeah. Oh, it's going to be, their role is going to become more and more and more important, because what we're all talking about is the importance of a medical home. And a medical home, pediatrics is actually one of the leaders in terms of being a medical home, because we follow kids, doing the growth charts and their immunizations and trying to do the preventive types of care. So all the models that we're looking at for the future has a medical home kind of on steroids as part of the thinking in terms of moving forward. If we're going to reduce healthcare costs, we have to get on some of these diseases before they occur. And there's some issues in kids. The number one reason for hospitalization is asthma. Asthma hospitalizations are very preventable. You just have to follow a regimen. You have to have kids on a regimen, and you have to give them their inhalers and give them their medications, but there's so many kids that don't get those, so they end up in crisis, which leads to hospitalizations and a lot of cost. So that primary care medical home is going to be an essential part of that for both kids and for adults.
Hi, my name is Maggie Taylor, and I'm a third-year management student. And I was just curious, what were some of the biggest challenges that you guys had when you were trying to blend the cultures of the two organizations after the merger?
Well, we had the doctors were probably the biggest challenge, because we had an academic culture. The Egleston Hospital was staffed by academic physicians, and Scottish Rite was a private practice, and each one thought they were better than the other one in all kinds of different ways. And what you had to do is try to bring them together and show them that they were more similar than different. And I think they were competitors, and to some extent they still are. So that was really the biggest challenge, is there was no economic alignment. You had to get them brought together in terms of a common purpose. The staffs came together quickly, because the employees, the nurses, the pharmacists, all those folks, what we found is when you'd put the Egleston mission statement and values and the Scottish Rite, there were tiny differences between the two, so it was really easy to bring those two together. The biggest issue were the physicians, because they had been competitors for all these years, and we couldn't just say, oh, all of you come together. Where we were able to do that quickly, we actually had to employ them, because you had to align their economic incentives, because what we found is even though their heart was there, if the economics weren't aligned, it was very difficult for them to see how to come together. That's why most hospital mergers in America fail, by the way, is the physicians.
Say a word about automated medical records and career opportunities in medical.
Oh, yes. All of you should be going into health informatics. There's a lot of hospitals, a lot of physicians are implementing electronic medical records. And for years, we've had tons of information and paper files sitting in warehouses, and we haven't been able to mine it and access it. So it's really transforming our industry to have the electronic medical record, but it's also created an enormous shortage in the types of people that know how to apply, program, project manage, help desk, you name it. I actually chair the Bioscience Leadership Council for the Metro Chamber, which is looking at how to get jobs growing again in Metro Atlanta, and we identified right now there are 2,000 open positions in medical informatics just in Atlanta. And of the companies that are in Atlanta, like 75% of them are going to be recruiting over the next several years. So if anybody's looking for a path to a quick job, I would suggest you look somewhere in this field of medical informatics, and there are a lot of different jobs around that. And you guys are all perfectly situated to be able to do that.
I actually have a question about your own leadership. In your time at Children's, you've been the CFO, the COO, and the CEO. What were some of the difficulties you had when transitioning between those roles?
That's a great question. Well, when you're a CFO, there's a beginning and an end to everything. It's like you close the books every month, you produce the financials. It's beginning end. When I became COO, Joe Rogers, who's an alum here at Georgia Tech, said to me, he's the CEO of Waffle House, he said to me one day, he goes, when you're the COO, it's like sweeping sand, which kind of means nothing ever gets, that begin, end. So that was a really hard transition for me because I was trying to put everything in a linear path to get it completed, and physicians aren't so easy to get in a linear path. So that was a big difference. CEO, I would say the biggest issue there is there's so much that you have to spend outside of your organization. So COO, you're in there every day trying to make it work. You're problem solving, you're organizing people, you're aligning them, you're inspiring them, you're trying to move the organization forward. As the CEO, you have to be overseeing that, but you have to be connecting the outside world. It's your job to set the vision with the Board of Trustees, and then to make sure you have the right leadership team in place, that you have the resources, so you spend a lot of time outside of the organization. And I don't think I was quite... everybody told me that, but I really didn't understand what it meant until I got into that role. And it's very, very important. It's the connecting your organization to many others is what I would say is a big difference for me as CEO.
Hi, I'm Jeremy Feaster. I'm a fourth-year chemical engineering major, and I was curious about what are some of the advantages and disadvantages that the Affordable Health Care Act is going to have on children's?
Oh, boy. That one makes me tired to even think about. Well, it's interesting because most kids are qualified, they qualify for Medicaid. Medicare is the federal program that's the same in every state for 65 and older. Medicaid is different in every state, and it applies to people that are below a certain socioeconomic level. Medicaid, so most kids qualify, most kids that are poor, which about half the kids in Georgia are in the category of poor, they qualify for Medicaid. But what's been happening over the last few years, that program started for children, pregnant women, and children. What's happened is today in Georgia, kids are 2/3 of the enrollees, but they account for less than a quarter of the cost because the age blind and disabled have been put into Medicaid and they're eating up all the dollars. So the biggest concern I have is when you take all the uninsured Americans, they're going to go into Medicaid and they're going to further dilute. There's not going to be that much more money that's going to come in the pool. So the little slice kids already get is going to get that much more, that much less. And it creates serious access problems because there's a shortage of pediatricians and pediatric specialists, and that's going to get worse. And who's going to take care of the kids? Because you have a lot of healthcare providers who want to take care of people that are insured, but you don't have a lot of healthcare providers who want to take care of poor kids. And so that's my biggest concern from what is going to happen. I think the other side to that is the challenge is it's restructuring our whole industry. And so we're having to implement electronic medical records, which is a whole new thing. That's a big change. Lots of alignment changes that are occurring, and so it's creating a lot of consolidation, just tons and tons of movement at the same time. Most physicians, if you go to most markets other than Atlanta, doctors cannot survive on their own anymore as private practice, so they're all being employed by healthcare systems, so that's a huge change. So there's just so much change coming at the healthcare industry at once that I worry that it's just going to implode. At the same time that we have an economic crisis, and the money, you all know what's going on with the federal budget and the state budget, so you're trying to drive all this change at the same time that your resources are getting so constrained. So it's a huge challenge. There's some, I think getting people insured is a good thing, but how in the world we're going to afford it as a country is the big challenge.
Hi, I'm Craig Zimmer from Health Architecture, and you all have spent a lot of money recently on your physical environment. I think you have plans to do more. And can you talk about the relationship between your investment in the built environment and your strategic goals?
Sure. Well, a big part of efficiency was one. The healing environment, we actually did a lot of work on colors. What colors do you put in what particular areas? So that was an important thing. In a children's hospital, it's extremely important because you have kids. So you could have babies all the way up to 15, 17-year-olds. So there's a lot of work you have to do around safety. For the children, again, in a children's hospital, you have issues with making sure that it's conducive because you usually have a whole family surrounding that child. So the physical environment is very important. And for kids, you need to keep them normal. So you want it to be bright, cheery. That's a big difference if you come to a children's hospital. Most people come in and they're like, oh my gosh, this place is so light and fun and cheery. You need to keep it that way because that's a big part of what helps kids heal. Was that a commercial for you?
I was just wondering if you had a hard time establishing this leadership role, being a female in what we consider mostly a male-driven environment. I know it's shifting to more females becoming physicians, but...
It's a great question. I get asked that a lot. At Children's, I'm fortunate enough to have been in an organization where a lot of the leaders have been females. So, I was CFO, COO. Right now, our general counsel is female, our CFO is. So we've had a more diverse leadership structure, which I think it wasn't difficult. I am one of the few female leaders of the other healthcare systems. So, I know it's harder in other places. I'm just a firm believer that if you perform and you deliver results, it doesn't matter whether you're a male or female. You're going to be fine. You just have to be confident in what you do, and you have to deliver results. And I think if you do that, no matter what your gender, you're going to be successful.
Any questions back there? I think we got one. Why don't you go ahead and ask that question first? Your question. No.
Hi, I'm Sarah Collins. I'm a fourth-year business administration major, and I've heard a lot about your internship opportunities and various volunteer opportunities, and because so many people want to give back to such a great organization, it's very competitive. And so for my roommate, I have to ask, what are ways that as college students we can get involved and give back and help you progress as you're moving forward?
Well, volunteering, I know, is one of the great opportunities, and we have a lot of Georgia Tech students that actually volunteer and tutor kids, because, we have a lot of kids that are in the hospital for long periods of time, so it's incredibly important that we have really smart folks like you who are helping them get their homework done, because we have school programs that we try to keep these kids in school, even though they're in the hospital, so that's certainly one way. There are lots of volunteer opportunities. The other that we're working more and more on is how to get you into helping us solve problems, and we were just talking about the opportunity to have some teams. I think Frank, who was here, was saying he was going to be working on trying to solve some problems with Sibley. So actually partnering with Georgia Tech to get some of your experiential learning to be at places like Children's, so that you're helping us solve problems and you're actually getting in the environment and getting credit for it.
You not only deal with children who are sick, but you deal with their families who are often stressed and frustrated. And how do you deal with the continuity of care once the kids leave children's health care, to be sure that they're continuing to get the kind of care that they need, so that they don't end up coming back? It just strikes me the same kinds of problems that we have in education.
Yeah, it's a challenge. That's a challenge. We have case managers that really try to follow the kids. You try to connect with that primary care home to make sure that you're getting the information back to their pediatrician, and that you're, as a kind of a village, trying to follow those kids. But it's particularly difficult for kids that are underserved or in the socioeconomically disadvantaged populations. But that's one of the things that I am excited about with everything that's happened with the Affordable Care Act, is really getting all the different players to work more together. And the electronic medical record is going to be critical to that, because if we can get all the information talking together, we'll be able to better understand who's where in the system, and are they really following up on the care that they tell us they were going back to their doctor, their pediatrician, but did they? If we can get everybody on the same electronic medical record, will actually be able to have a record that is a longitudinal record that we can follow.
Donna, thanks for coming to Georgia Tech today.
You're welcome. Thank you for having me.